Dislocation causes and treatment. A dislocation is a type of joint injury where the end of the affected bone is forced from its natural position. While the hips, elbows, knees, ankles, fingers, and toes are all subject to dislocation, the shoulder is the most commonly dislocated limb joint. No matter what joint or bone is involved, dislocations are usually the result of a sudden blunt trauma to the joint, usually from being struck during a fall, sports activity, vehicle accidents, or other forceful trauma. However, there are certain medical conditions where joint dislocations are spontaneous, meaning trauma isn't the root cause. Ehlers-Danlos syndrome, a group of inherited connective tissue disorders involving a defect in the synthesis of collagen, and congenital hip dysplasia, a misalignment or deformity of the hip joint, are examples of conditions where the joint dislocation isn't related to trauma. Dislocation symptoms include marked visibility that the joint isn't in a normal position or is misshapen and discolored, swelling of the affected joint, bruising near the affected joint, limited range of motion or immobility of the affected joint, sudden and intense pain, especially when the joint is attempted to be used or weight is placed on it, possible tingling or numbness at or past the joint, and nearby muscles may spasm and intensify the pain. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your injured area to reduce redness, swelling, and inflammation, while dispersing accumulated blood and fluids to help restore normal circulation to the injured area. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your injured area with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your injured area with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your injured area to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.